But right now, do you vape or do you know someone who does? You might have someone in your family quite a bit younger than you, maybe a child or a grandchild who vapes. If you look at the figures on that, 1 in 7 14 to 17-year-olds and 1 in 5 18 to 24-year-olds are current vapers. So the government has long promised action, and we've now got the detail on that action. And the very first stage of the vaping reforms, which amount to essentially banning the importation of disposable single-use vapes from the 1st of January. Do you think that will make a difference? 1300 222 774. And if you don't, is there something else that the government should be doing to try and reduce the number of young people who are choosing to vape? Well, one person who's not so sure that a ban is going to work, Dr. Colin Mendelsohn. He's a former GP and he's the founding chairman of the Australian Tobacco Harm Reduction Association. Dr. Mendelsohn, welcome to Drive.
Thank you, Ali.
We've only got, the first stage. I just talked about the banning of the disposable vapes from the 1st of January. There's going to be other changes that will be made during the course of next year, including the licensing of importers and also a greater enforcement of regulations around the actual product. Is it going to work?
Look, I don't think so. We've tried this model already, Ali. We've tried the prescription model. It's been rejected by vapers. Less than 10% of vapers actually have a prescription. Less than 2% of doctors are willing to prescribe nicotine. So what vapers have said is, look, I want this product. It's helped me to quit smoking. I can get it from the black market, and that's what they're doing. And we've got a rampant black market which is controlling this whole industry and creating all the problems that you would expect from a black market.
But just on that, essentially saying that a prescription model has been rejected, but isn't the issue that because it's so readily available on the black market, no one needs a prescription? And I guess we should note that one of the other changes that is being made is to, well, in some ways make it easier to get a prescription, because there's going to be, nurses will be able to give prescriptions as well from the 1st of January. So is it that the circumstances have not been right to give a prescription model a fair go?
Look, I think the problem is that we've chosen this prescription model from the beginning. The alternative model is for vapes to be available from licensed retail outlets as adult consumer products, sold with strict age verification. That's what's done in other Western countries, in New Zealand, the UK and the US. And that's working really well. And if you have a license to sell these products, it's a profitable item. You won't be selling these products to kids, and that will restrict access to kids. Of course, some will get through. But that model's working, and the model we've tried hasn't worked. And we're the only country to have tried it. And I think doubling down on a failed model is almost certain to fail again.
It's on that licensing. It's an interesting point, because the changes will require a license for an importer of therapeutic vapes. It doesn't talk about a license for domestic suppliers of vapes.
Well, the only people who will be able to supply vapes when this model begins, and it's currently true already right now, is pharmacies. So retail outlets are not legally allowed to sell vapes to at all with nicotine.
So you wouldn't need
a
license, wouldn't be necessary, because they're already in a verifiable
banned anyway.
Retailer. Yeah,
that's right. They're already banned anyway, and that's the problem, that we've got this ban already, and it's just not working. And we've got free access to young people through the black market, because we've created such a thriving black market. All the adults are going to the black market. They sell totally unregulated products freely to young people. And that's why we've got a problem with youth vaping. So the problem is to eliminate the black market. And the only way you can eliminate a black market is to replace it with a legal, regulated market, as they've done overseas.
So what would that involve in the Australian context? Because, it's for those of us who don't vape, it's actually quite hard to work out exactly what the laws are, because they seem to be so regularly flouted.
Yes. Look, vapes are adult quitting aids. Basically, they're designed to help adult smokers quit. Now, look, some kids are going to use them, and that's inevitable. Kids take risks, and we need to do what we can to reduce that to a minimum. They can legally only be purchased from pharmacies, but they're widely available now through illegal outlets and social media. So what we need to do is have them sold. And the trouble is, with the pharmacy model, they're not accessible. Adult smokers who want to quit find it really difficult to access them. They can't find a doctor who'll prescribe. And I really don't think the doctors are going to suddenly change their tune. The doctors are very sceptical about vaping in Australia. They're very poorly informed. And I don't think it's suddenly going to change. I think there'll be a lot of opposition in the medical profession to this new development.
So you're saying that if the pharmacy model is not accessible, then we should be selling them in shops, but selling them in a way where there is a licence requirement around that?
Well, just like any other adult consumer product, just like we do for cigarettes and for alcohol, look, we don't want people to smoke, but people have a choice and they're responsible adults who can make decisions, but we can stop them from going to kids. And vaping should be no different. It certainly shouldn't be harder to access a product that's at least 95% safer than smoking than it is to access cigarettes, which are deadly. And that's how we've made it in Australia.
At the same time, the prescription model does work for most other drugs.
Yes, but it doesn't for this because doctors won't write prescriptions. And vapes are not regarded by most smokers and vapers as medicines. They don't see themselves as sick, needing to go to a doctor. They see this as a replacement for their consumer habit of smoking. This is an alternative to smoking, but a much safer one, which is life-saving. They don't see why they should have to get a prescription for that when deadly cigarettes are available on every street corner.
So is the problem that we don't licence the sellers now? I mean, if you look, at, for example, at tobacco, in this state, we don't licence our tobacco sellers.
Well, we certainly should have licences, but the problem has gone way beyond that now. So the black market has just taken over and there's no way you would license the black market. But most vapers say, and the market surveys have shown this, that if they can buy their products from a regulated retail outlet with regulated products, and where they know they're safe and they know it's legal, they would much prefer to do that. So people will switch to a regulated consumer model, buying them from a convenience store like they buy their cigarettes. And they won't buy them from the black market. Some will, but we know the only way to eliminate the black market is to provide a better alternative.
But
just
a regulated consumer model probably would still mean that kids would get hold of them, just like they do cigarettes.
Of course, there'd always be some leakage. But if your licence is tied to very strict controls about supplying to children and harsh penalties and loss of licence, you've got a lot to lose. At the moment, in the black market, there are small fines and very small risks, and very few people are being caught. But with a licensed supplier, you would lose, yes, a significant part of your business if you were to follow go down that path of supplying to kids.
You're listening to Dr. Colin Mendelsohn, the chair of the Australian Tobacco Harm Reduction Association, and we're talking about the government's announcement that it will ban single-use vapes from being imported from the 1st of January. It's just the start of the moves being made to try and reduce vaping. Do you think, Dr. Mendelsohn, that you've lost the argument?
No, I don't. I think we will win the argument because I think it's increasingly clear that this approach is not going to work. And I'm surprised that Mark Butler's pushing ahead in spite of the very clear evidence from overseas. And I don't know what his decision to take this pathway is based on, but the evidence is very clear that vaping is a huge public health opportunity and we need to make it available for adult smokers because our smoking rate in Australia has flatlined in the last 4 years, according to Mark Butler, and that's true. Whereas in other countries where they're vaping, smoking rates have accelerated downwards. So we need to make these products more accessible and more available for smokers. And I think that will become clearer and clearer as time goes by. And I think Mark Butler is just pushing the can down the road for whatever reasons. But it's not based on the evidence that as I understand it.
Just another question. We actually covered this quite extensively on this program recently, and this was New Zealand's decision to put in place a ban on cigarettes that would essentially have stopped those born after January 2009 from ever being able to legally buy cigarettes. They're reversing the ban.
Yes. Look, I was never a supporter of that ban, and there are several reasons. One is that very few young people smoke. The problem is not young people smoking, it's that their fathers, parents, and grandparents are unable to quit and are dying. And I think we need to focus our attention on that. I think this will be incredibly hard to get compliance. So there won't be any regular. So at one age you can smoke, another age you can't, and I think these products will be available through the black market for kids who want them. And the kids will take risks. Kids will do what they want to do anyway. I don't think that's a good idea, but it's not a priority.
Well, Dr. Colin Mendelsohn, what do you think is going to happen from here? Because when you look at the numbers of kids who are using vapes, and, you've only got to look at the rubbish on the streets to know how many people are using the disposable vapes. From what you're saying, this is not going to resolve the problem.
Look, kids shouldn't vape or smoke, but of course they're going to anyway. The reason why we've got such widespread vaping in Australia is because of the black market, and that's taken off since the original ban back in October 21. So the timing is very clear. We've created that youth vaping increase, and the only way to eliminate that is to eliminate the cause, which is the black market. We need a different approach altogether, not more of the same, because that won't work.
And Dr. Mendelsohn, just in response to a couple of texts, can I ask you, do you get funding? Does the Australian Tobacco Harm Reduction Association get funding from the vape industry, from the e-cigarette industry?
Absolutely not. Absolutely not. I'm not a member of the. I was the founding chairman, but not currently chairman. But we publicly declared 2017-18, ATHRA received a small amount of funding to help set up the charity, but it's received absolutely no funding since. And I personally have never received funding from e-cigarette or tobacco companies.
Thank you for clarifying, and thank you for talking to us.
Thank you very much, Ali.
Dr. Colin Mendelsohn there, former GP, founding chair of the Australian Tobacco Harm Reduction Association. I wonder what you think. Do you think banning vaping will work, or are we just going to create a black market? 1300 222 774. I'll take your calls, but first let's get another check of the traffic with Caroline Ferguson.
ABC Radio.